mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e
Buenas tardes a todos, bienvenidos nuevamente al curso de inglés relacionado con el área de la salud. Bienvenidos sean todos ustedes, mi nombre es Rubén Hernani Machicado y yo soy el encargado de dar continuidad a este seminario que ya está en su segundo día. El día de ayer ya habíamos iniciado y bueno, hoy día terminamos con el mismo, ¿ok? Primero que nada, indicarles que en este día vamos a trabajar de una manera similar, pero esta vez lo vamos a hacer directamente desde Zoom. ¿A qué me refiero? Que vamos a hacer la clase más participativa. Vamos a empezar a trabajar con ustedes de forma tal de que podamos interactuar. Dame un momentito, por favor. Ya, estamos eliminando el sonido de afuera. Ok, bueno, como les decía, vamos a interactuar directamente y para ello tenemos ciertas reglas, ¿ok? Lo más importante, yo voy a ir dando el curso y si ustedes tienen alguna consulta pueden utilizar el chat de Zoom, ¿ok? También aquellos que estuviesen por YouTube pueden hacerlo por el chat en vivo de YouTube, ¿ok? Pero estamos acá directamente por acá. Cada vez que quisiéramos interactuar, hablar, comunicarnos, yo les pido encarecidamente que puedan levantar la mano virtual, ¿ok? De manera tal de que se les dé el acceso al micrófono y ustedes puedan hacer su consulta o, en este caso, hacer la interacción que vamos a trabajar el día de hoy con ustedes, ¿ok? Espero que puedan haber comprendido todo y bueno, vamos a continuar. No se olviden que para poder recibir toda la información pertinente acerca de los certificados, etcétera, no olviden comunicarse, si no lo han hecho aún, con los teléfonos que salen en pantalla de chat en vivo de YouTube o por acá por el chat de Zoom, ¿ok? No se olviden de ello. Bueno, dicho esto, vamos a continuar. Voy a darles un poquito acerca de mi experiencia. Estoy casi 19 años, un poquito más en el área del inglés. Ya hemos trabajado en bastantes lugares, instituciones, colegios y ocupado diferentes cargos a nivel departamental y a nivel nacional como coordinador académico, tanto departamental, nacional y obviamente director académico de varias instituciones. Entonces, esto me dio la posibilidad de poder adquirir la experiencia necesaria para poder realizar no solamente estos cursos, sino trabajar en diferentes áreas, ¿ok? Bueno, dicho esto, vamos a comenzar. Primero que nada, bienvenidos a todos los participantes. Acá tengo varias personas que están ingresando y que están siendo bienvenidas. Muchísimas gracias por las palabras. Y bueno, pues podemos empezar. Como les dije el anterior mes, el día de ayer, vamos a trabajar todo en inglés y obviamente algunas partes lo voy a hacer en español. ¿Por qué? Porque necesitamos saber cómo es la relación del inglés con el español en el área médica. ¿Ok? Cualquier consulta la pueden realizar en inglés o en español, no hay ningún problema. Bueno, let's start. We are going to review some things that we did yesterday so you can remember and then we can continue with what we need to, okay? First of all, we have talked about the body parts, which is essential. So in that case, we have the physical body parts, and in that way, let's see, los nuevos, uno nuevo. Okay, very good. So we said the body parts. We divided the body in three: the head, the trunk, and the limbs, right? So the first part is the head, which we have the head itself, the hair, the face. This is the face. Then we have the nape, the nostril. So we have the forehead, the eyebrows, eyelids, eyelashes, and eyes, son las partes del ojo. Also, we have the eye bags. We have the cheeks, the bone cheeks, right? This is the nose, right? We have also the lips, the ears. We have the mouth itself, the upper lips and the lower lips. We have the teeth. Only one is tooth. All of them teeth. Then we have the tongue. We have the vocal folds. Yes. We have a chin. That it is. So we can continue with the neck, which is cuello, right? Then we have the shoulders, Then we have the chest, and for women we said it is breast. Then we have the abdomen part, the stomach, right? Then we have the waist, the hips, and that will be all about the trunks. Let's go with the limbs. We have the arms. All of them are the arms. This is the forearms. This is the upper arms. Then we have the wrist. This is the wrist. The hand. This is the palm. These are the fingers. This is the thumb, index, the middle finger, the ring finger, and the little finger. Yes, or pinky, right? We have those. These are the knuckles, and this is the fist, palm, fist, okay? Fist. So that it is. Let's continue with the parts of the legs. We have the leg itself. We have the calf. Yes. Then we have the foot or feet, the knee. Then, as I remember, we have the ankle. Yeah, we have the sole of the feet, right? Of the feet, sole. Then we have the heel, el talón, heel, and the toes, los dedos del pie, toes, right? So all of them are the parts of the body. But let's go inside. Inside we have the brain. We have the heart, el corazón, the lungs, los pulmones, stomach, el estómago, the kidneys, los riñones, the liver, el hígado, the liver. Then we have the intestines, the large intestine, yes, the large intestine, el intestino grueso, and the small intestine, el intestino delgado. Then we have the bladder. The bladder is la vejiga, right? As far as I remember, all of them. If I don't remember something, just let me know, okay? And I think that will be all. Let's see. Okay, hello, good afternoon, Maribel from Ecuador. Good afternoon. Jennifer, good afternoon. And all of them, right? Welcome. Let's continue. So those are the parts of the body. Now let's continue very fast with we have some prefixes and suffixes that we have already learned. And here we have some of them. I will just go like this. The prefixes are the ones that we have before the group of words that we have before the word. So like cardio, neuro, derm, hyper, hypo, anti, epi, hypo, inter, intra, peri. For example, derm is related to the skin, neuro to the nerve, cardio to the heart, hypo is under, and hyper is excess of, right? Like hypertension, hypothermia, right? Then we have also more prefixes: bi, micro, multi, poly, etc., which help us to know what we are talking about. For example, anticoagulant, right? Or dysfunction, right? So neonatal, right? So it's neo nuevo, right? We talked about it yesterday. Then we talk about the suffixes. What are the suffixes? The group of words, the letters that we add at the end of a word. Yes, like iris, ology, actomy, for example, appendectomy, right? Biology. We have gram, electrocardiogram, mammogram. What is gram? It's a test, it's a record, right? Oocyst, right? Another one, oma, right? Carcinoma. Rhea, rhinorrhea, runny nose. What is runny nose? Do you know runny nose? Runny nose like a tarro, right? So urea, right? Hematuria, right? That means blood in the urine. Yes, that it is. Let's continue with more suffixes: otomy, ostomy, plastiscopy, etc. So all of them are part of the suffixes that we need to know in order to name or understand a word in the medical area, right? We have more graphy, for example, hemolysis, right? Lysis. We have also megaly, yeah, cardiomegaly, and meter, that means a measure, right? Tinea, right? Leukocytopenia, right? That it is. So the last one, rhesis, myorrhesis, is a rupture, right? So we talk about all of them. Then we talk about also about this one. Good morning, my name is Dr. Espinoza. So professional introduction. We talk about how to introduce yourself. As I told you, this is just an example. Just an example. Okay, you can do it in the way you feel okay, you feel fine. You can say good morning, good afternoon, good evening. My name is Dr. Espinoza, your cardiologist. I am Nurse Ramirez. Good afternoon, I'm your neurologist. My name is, right? It will depend on you. Now let's continue with the next one. How is the way that the patient is going to introduce himself? For example, my name is Juan Rodriguez. I'm 45 years old. I'm here for a checkup because I feel unwell, right? Or I don't feel very well. A little bit of water, sorry. It says also, good afternoon. I'm here because I have a backache, right? So we talked about all of them yesterday. Now, these are the questions that we talked about yesterday. What brings you here today? Where does it hurt? What are your symptoms? How long have you had these symptoms? Very good. Are you taking any medication? Are you allergic to any medication? And please try to focus on this, because at the end we're going to start working with this as if I were the patient and you are the doctors, okay? That's what we are going to do. So, instructions for patients. This is when you have to check the patient, right? Please lie down on the bed, breathe in, hold, breathe out, right? Como nos respiremos, mantengamos la respiración, bote el aire, right? Breathe as if you are running. What is that? Breathe as if you were running. Right? Como si estuviese corriendo. Take this medicine twice a day after meals, or maybe open your mouth and stick out your tongue. Tell me if it hurts or not when I touch it. Yes, but this is not the end. You can use any other open-ended questions or yes/no questions for better understanding. So, do you have this? Are you okay with this? Does it hurt here? Okay, and the patient is going to say yes or no. Okay. Now, the symptoms that the patient may have. I have a headache. I feel dizzy, nauseous, tired. It's aching. I cannot move my arm. Yes, I'm fainted, and when I woke up, I was at the hospital. it is commonly this sentence. My ankle is swollen, right? That's what we talked about yesterday. And the symptoms, right? Could be headache, backache, toothache, stomachache, earache, heart attack, my body aches, my arm aches. Also, you can say, I have a pain or a pain in my, that means tengo un dolor en. Could be, for example, I have a pain in my back. I have a pain in my hips. Okay, or maybe I have a pain in the back part of my head, the nape. Okay, so well, let's check it, right? So there are many ways, but the most important thing for this example is that you need to understand that aches means dolor. This the same as saying pain, the same as saying heart, but there's a difference. Pain is dolor. Ache también es dolor, but we most of the time we use it pasted with a word, back ache, with a body part, right? Pain also, but alone. My finger, I don't know, my pinky finger is in pain, right? I have a pain in my palm. I don't know, but when you want to say heart, that means doler. It's a verb. It's not a noun. So my elbow hurts, right? Me duele el codo. I don't know. Just an example. But that it is, okay? You can use it in the way you want, but don't forget aches and pain is dolor and heart is doler, the verb, okay? So that is the way you need to know. Now, let's have the signs that we also talked about yesterday. The patient has fever, right? Don't forget that we are using the Celsius degrees, but we can use the Fahrenheit as well in other places. Blood pressure is elevated. The patient feels dizzy, mareado. The patient is throwing up, vomiting. The patient is freezing, cold, congelándose. The patient has lost memory. He doesn't remember anything. Or the patient is not breathing normally, very fast or very slow, right? The patient has a headache, as you know, and I already told you. Let's continue with the diagnosis. Yesterday we talked about it. We have pneumonia. This is a case of hypertension. You have just a flu, yes? You twisted your ankle, or this is a case of arthritis, right? Any osteoarthritis, etc. Okay. Here's what we need to continue. What is the treatment? We stop in diagnosis, right? Now let's start working with the treatment. When we talk about a treatment, we are saying what they have to do, what orders they have to follow. And the first word that you need to know is prescribe, 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 okay? Prescribe. I will prescribe antibiotics, or I will prescribe you some antibiotics. You can give me the antibiotics you want, right? You need to rest and drink plenty of fluids. When I said plenty of fluids, means a lot of fluids, water, or I don't know, any other liquid, right? Please take these pills one every 8 hours or every 6 hours. I don't know. It will depend on you, on your prescription, right? So also we can say take rest and eat soft, white food. What does soft white food mean? That means comida blanda y blanca. Okay? Only comida blanca, white food. Comida blanda, soft food. Soft white food, comida blanca y blanda, right? And come back in 1 week. I will check you again in 3 days, 4 days, or tomorrow, okay? So it will depend on your prescription, on what you are checking, okay? That is the way, okay? Let's continue now. When we talk about this treatment, I'm sure that you already know how to do it. So in this case, this is what we are going to start working with. Okay, I want you to start writing in the chat of Zoom. Please write down some prescriptions that you usually do, that you usually write, that you usually tell your patient. Please start writing. If it's in English, great. If it's in Spanish, it's also okay. We will translate it into English. Okay, so please start writing. As I told you, this is a very interactive session. Okay, I'm trying to do this one more than yesterday. So start writing, please, in the chat, your prescriptions. How do you prescribe your patient? Just write. Remember some of them and start writing. Start writing, okay? Please, because these are just some examples, 5 examples to tell you the truth, but you may have many other kind of prescriptions. So let's write it, please. Start writing in the chat, please. And in the same way, please start writing in the virtual in the chat in YouTube, okay? In the chat en vivo, in the live in YouTube. Please start writing as well. You can do it. If not, you can do it here, please, in the Zoom chat. Please start writing. I'm waiting for your answers. Prescribe. Imagine that you are prescribing a patient, okay? Do it, please. Do it. I'm gonna wait for you. You can do it in Spanish or in English. There is no problem. Ok, pueden hacerlo en español o en inglés. Vamos, empiecen a hacer las prescripciones médicas, ok? ¿Qué le dicen al paciente? Please start working on it. In English or in Spanish. But come on, do it. I will wait for you. Yeah, we have a lot of participants here. We have more than 25. Please start working with what I told you. Right, please. Escriban. Freddy César levantó la mano, please. He wants to talk. Freddy, puede hablar. Creo que le han dado la opción.
Hi,
Mis,
good afternoon. I understand. Bueno, lo voy a decir en español. Entendí que quiere que digamos esto traducido o que lo escribamos en español o decir en inglés, perdón.
Me gustaría que lo escriban. Si puede hacerlo en inglés, hágalo en inglés. Si puede hacerlo en español, hágalo en español. ¿No? Yo lo voy a traducir. Lo importante es que ustedes coloquen todo para que podamos tener mucho más experiencia acerca de cómo poder hablar en inglés. Entonces, escriba, por favor, una prescripción médica, algo sencillo, y lo vamos a traducir si lo hacen en español. En inglés, perfecto, lo vamos a leer, ¿ok? Here it says administrate 18 units of oxytocin intramuscular stack. Very good. Thank you very much, Katie. Thank you very much. Thank you very much. Please continue working. Continue working, please. Continue working. I have another one. It says Olmedo. ¿Cómo se dice nada por vía oral? Okay, so you can say nothing by mouth or nothing orally. There are many ways to say it. Hay muchas formas de decirlo. The most common, nothing orally or nothing by mouth. Okay? That it is. Nada vía oral. Okay? I will prescribe Tylenol 500 milligrams. Very good. Thank you, Stefan. Thank you, Stefan. Continue, please continue. Thank you very much. That it is. Continue working with that prescriptions, please. Yeah, prescribe anti-inflammatory example, diclofenac, 75 milligrams, antihypertensive, carvedilol, 625 milligrams. Very good, Natalie. Thank you very much. Thank you very much. That is the way, please. If you are checking the chat, you can also take some writings about it. Yeah, take notes. Maybe it's something very useful to learn in this way. So if you realize this is just an example and we have more that you in real life are doing, right? So please start working on it. Please continue working on it, please. Write down two more and then we will continue, okay? Two more and then we will continue. I forgot to check the YouTube. Yeah, very good. Okay. We have 1, 2, 3. Yeah, that is nice. Oh, great. Dear boy, you can drink beverages sugar added because you... okay. Don't worry, sir. So you can say, dear boy or guy or girl, you can't drink beverage. Yeah, you can drink beverages with sugar or with sugar added because you are being shot in with insulin. You can be shot or shot with insulin. Okay, está siendo inyectada con insulina. You're being shot with insulin. You're being shot with insulin, right? Está siendo inyectada con insulina. Very good. Excellent, Mr. Cesar. Okay. That it is. Let's continue with the rest. Intramuscular injection every other day for 3 days. Very good. ¿Cómo se escribe inyectado? Injected or shot. La forma correcta es injected, pero la forma del spoken English, del colloquial English is shot. Reciben un shot, right? S-H-O-T, S-H-O-T, that is a shot. But you can say also injected, okay? That it is. What else? Intramuscular injection every other day. Very good. That is very nice. I like what Majo Quezada is doing. Thank you very much. Every other day means día por medio, every other day. You can say every other day or every after day, okay? And that is very good. For 3 days, that is excellent. That is great. Let's continue. Thank you very much. If you want to write prescriptions, continue writing your prescriptions, please. I will be very happy to continue reading while we are going on, okay? Well, let's continue now. Clinical communication skills is almost the same, right? If you are in a hospital or in a clinic. Good morning, my name is Dr. Espinosa. I am your cardiologist. I am Nurse Ramirez. I will take care of you today. Good afternoon, I'm your neurologist. My name is Dr. Camacho, right? You already know. And this is not different, okay? Let's continue. My name is Sarah Green. I am 32 years old. I came because I am not feeling well. I don't feel very well since yesterday, right? I have a terrible pain in my back. I have a terrible pain in my back. My back hurts, right? I feel dizzy as well. I feel dizzy. That is very good. So this is the way the patient is starting telling you the symptoms of what that patient is feeling, right? So just an example. Now, before working with medical records, this is something very important. I know that you listen all the time, your patients, and I would like you to write now some symptoms that you have heard, que hayan escuchado from your patients. Okay? Just write. Why? Because in that way, we will have more knowledge about how to listen or what to listen and start working with them, right? So please, I would like you to write down all, at least 2 or 3 or 4 patients' feelings, right? It doesn't matter the name, just I have a terrible pain in my back. I don't know. I am vomiting. I am throwing up all the time. I don't know. Or maybe I feel very tired. I just want to sleep. I don't know. Start writing, please. Start writing so we can read for everybody. Okay? Please start working on it. Start, please. Start. Working in the chats, please. Here I have more. Uh, administrate one intravenous globular packet stat. Great, miss. Great, that is very good. Continue, please. Continue. Write down all the symptoms that you have listened from your patients, please. I'm gonna wait for you. Write it on the chat, please. Write in the chat. Do it. I will be waiting for you. Meanwhile, while you are writing, mientras están escribiendo, don't forget, no se olviden, que si es que desearan interactuar de manera oral, simplemente levantan la mano virtual y les van a activar el micrófono para que puedan hablar, ¿ok? Mr. César, lo que dije que fue que puedan escribir en el chat algunos síntomas que escucharon de sus pacientes, qué es lo que sus pacientes les dicen. Puede ser en inglés o en español. Si es en inglés, está súper. Si es en español, lo vamos a traducir en inglés. ¿Ok? Empecemos escribiendo en el chat de Zoom los síntomas que escucharon de los pacientes. ¿Ok? O que escuchan todos los días de sus pacientes. Please, hagamos unos cuantos. Let's start working on it. Please. Como les decía, no se olviden comunicarse con los teléfonos que tiene la institución para, en caso de que no lo han hecho aún, para poder recibir los certificados correspondientes y a la vez, si quieren recibir el video o quizá la presentación, también pueden hacerlo, ¿ok? Tanto por los teléfonos que tienen acá en el chat y el otro puede ser por el chat en vivo de YouTube, ¿ok? Estamos esperando. Acá tengo uno, el señor Olmedo. Dice, tengo vértigo. Ok, tengo vértigo. Vértigo is something, something usual, let's say, in English and Spanish. Says, tengo vértigo, I have vertigo. Okay, there is no problem. Vamos a ver, acá tengo más, ya están empezando. Very good, thank you. A ver, veamos. Acá dice, siento escalofríos en el cuerpo durante las noches, por las mañanas tengo congestión nasal. Okay, very good. That is great. Escalofríos, shivers, you are shivering, right? Shivering, escalofríos. So, y por las mañanas tengo congestión nasal. Okay, we can say it in this way. You can say, I am chilling, or I am shivering, cualquiera de los dos. I'm chilling, or I have shiverings, I am shivering, sorry, or I chill, tengo escalofríos, in my body at night, and in the morning, I have a nasal congestion. Okay? So you can say, I'm chilling at night, and in the morning, I have a nasal congestion. I have another one from Katie. Katie says, please, teacher, can you translate? Nausea, okay. Nausea is the same as in English, as in Spanish. Nausea. Then visión borrosa. Well, you can say blurred vision. Okay? Blurred vision. Then you said zumbido en los oídos. Okay. You can say for example, you can say okay, I will do this. I have nausea, then blurred vision. I have a ringing in the ears. Estos son síntomas clásicos de la preeclampsia. Okay, yes. So, thank you very much for telling me that. So, I will tell you again, complete, so you can know. So, I have nausea. I have a blurred vision. I have ringing in the ears. Okay. Yeah, that it is, right? That it is. Thank you very much. Those are the classic symptoms of the preeclampsia, okay? Preeclampsia, thank you very much. Hi, my name is Mark Stevenson. I came today because I have a migraine that doesn't go away. That is great, Stefan. That doesn't go away. Very good. That is very good. Paciente con dolor de cabeza. I have a patient with a headache. Very good. I have a patient with a headache. Then another one. Here I have another one. Can you write, please? Okay, puedo. A ver. Yeah, it's the same. Vertigo is the same as that in Spanish. I have vertigo, okay? Paciente con problemas, Natalie está escribiendo, paciente con problemas de osteoporosis. Okay, osteo, we said that osteo is a prefix. Do you remember? So osteo is osteo, right? Now, osteoporosis is osteoporosis. In the hips, possible surgery, de prótesis de cadera total. Okay, So you can say prótesis de cadera total. You can say patient with osteoporosis problem in the problems in the hips, okay, and possible surgery of total hip replacement, total hip replacement, total hip replacement. Oh, los síntomas de la preeclampsia. Yes, yes, yes. So I'm gonna write it. I'm gonna write it. Don't worry. I have. What is it? I have nausea, blurred vision, ringing in the ear, ringing in the ear. Well, no, I have. Well, maybe the patient has nausea, ringing in the ear. Those are symptoms. Okay, symptoms of preeclampsia. That it is. I already did it. Thank you very much, sir. That it is. Okay, I hope you understand that. Thank you very much. That was excellent, guys. Excellent, people. This is the way I wanted you to start working with it, because in that way, I am not only giving you the results in English. You are giving, and also you are teaching everybody. We are learning together, right? That is very good. Okay, you can continue writing. There's no problem. Continue writing, okay? So now let's start working with medical, reading and interpreting medical records, okay? There we are. So we have commonly medical abbreviations, and this is very easy. Sorry, I forgot to see if someone did something in the YouTube. No, okay, very good. Let's continue. The main goal for this common medical abbreviation is to recognize and understand the most frequently used medical abbreviations in patient charts, hospitals, records, etc., right? So that is what we are going to do now. So, sorry, medical prescriptions. So here we have, look at that. We have now the general abbreviations. What is BP? The BP is blood pressure. Blood pressure, okay? Presión sanguínea, right? HR, heart rate, heart rate, heart rate, heart rate, right? Temp is just temperature, temperature, temperature. Within normal limits, dentro de los parámetros límites normales, right? W and L, right? Also we have, for example, TX, treatment, treatment, treatment. Patricia Jimenez, welcome from Ecuador. Thank you very much. Yeah. TX treatment. RX, what is RX? That is a prescription, what we did in some minutes before, right? So, prescription. We have also HX, that is history, history, medical history, right? FX, FX, fracture, fracture, okay? Fracture, fracture, okay? Those are the ones that it is. So let's continue working now. If you have any DX diagnosis, right? Sorry, I didn't say that. DX diagnosis. Let's continue with this. When we talk about time and frequency, we can say QD, this is once a day, bid twice a day, TID 3 times a day, QID 4 times a day, PRN as needed, you know what it means, lo que se necesite, right? Stat, immediately, in that moment, okay? Immediately, stat. Sorry. Let's continue now. Where we have hospital and clinical settings. What is, this is what yesterday, for example, some people asked me to tell you, and this is the ECU, the intensive care unit. Intensive care unit. That is intensive care unit, unidad de terapia intensiva, right? ER is the emergency room. ER, emergency room, and you have checked in many movies and also series that we have the ER, that's an emergency room, right? IV, for example, intravenous, right? IM means intramuscular, the injection intramuscular, the injection intravenous, right? MPO, nothing by mouth. What I told you, nothing by mouth, right? Nothing by mouth or nothing orally. That it is, ambos son correctos. Nothing by mouth, MPO. But if you realize, MPO has nothing to do with the, as an acronym of this, because this nothing per orally, but it's nothing by mouth, right? Nada vía oral, okay? So that it is. Another one, yeah, intravenous. Very good. Let's continue. Before going to the emergency situations and first aid vocabulary, I am sure that you may have some others abbreviation, medical abbreviation. I told you 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and 14, 16, 18, 21. So why don't you start writing? Let's start writing now in the Zoom chat. Please start writing some other abbreviations that you know, okay? That you know, and if you don't know, there is no problem. We are gonna check it, okay? But please start working with other some common abbreviations that you may know in the area you are working, for example, right? So why don't you start writing, please? Start writing in the chat of Zoom or in the virtual chat of YouTube. Please start working on it. Start working on it, please. Write down some of them, the ones that you know. Write it. There it is. that it is. Here I have Stefan. M-R-I-E-N-T-E-K-G. Okay. M-R-I-E-N-T-E-K-G. And MRI is magnetic resonance imaging. Magnetic resonance imaging, okay? Magnetic resonance imaging. That is the MRI, sorry, MRI. The ENT could be ear. I don't know if I am right, Stefan. Ear, nose, and throat. What is throat? Garganta, okay? Ear, nose, and throat. Maybe that is the one in otorrinolaryngología, right? So let's continue. I here have more. Wait a minute. EKG. That is electrocardiogram. Okay? Electrocardiogram. Very good. Thank you very much, Stefan. That was very good. We have another ones. We have RX, yeah. That means rayos X, RX. Thank you very much, sir. RX. We can continue working with that, please. Here, SC, yeah, subcutaneous, very good, subcutaneous. SC, subcutaneous. IR. Intrarectal. You know what is intrarectal, right? Intra is the suffix that means inside. Intrarectal. ATX. Tranexamic acid. Yes, ácido tranexámico. Okay, thank you very much. Katie. Effects in your neck and hemorrhage in mouse. Okay, very good. Thank you very much. It says here, hola, no se escucha nada, no tiene voz. Bueno, en este momento yo tengo todo correcto. Creo que todos están, por favor, si alguien puede escribir al chat que si me escucha o no, porque la licenciada Aguayo no me escucha, tal vez sea sí se escucha, entonces tal vez sea un problema, thank you very much, tal vez sea un problema un problema suyo, licenciada Aguayo. Puede fijarse tal vez, generalmente es el problema con los audífonos, cuando estamos con los audífonos que olvidamos cambiarlo en el ordenador. Tal vez puede ser eso, por favor, si lo puede revisar. Muchísimas gracias. Thank you very much. Okay, let's continue. So, if you have some other abbreviations, I will be very thankful to read them for you. Okay. Si hay algo más, algunas abreviaciones, estaría completamente complacido de seguir leyendo para ustedes, okay? Thank you very much. Let's continue now. Just continue writing, please. We did all of this. Yeah. Let's continue with the emergency situations, okay? Let me check in YouTube first, please. No, there is no questions, okay? There isn't any question. Very good. So now let's talk about emergency situations and first aid vocabulary, okay? So trauma and injuries, right? And here is, I have something before we go there, something that I have here for you in the picture. So what are the 6 steps, right? In case of an emergency on the street or at home. It says here, call emergency. That's the first thing you have to do, call emergency. Call emergency, right? Maybe you need to tell your people what to do so you can check this. Number 2, check the vital signs. Check vital signs. Number 3, check breathing. Check breathing. Respirar, right? Check breathing. Now, lift the chin. You remember the chin, right? This is the chin. Lift the chin. Levantar el mentón. Lift the chin, right? So the person can breathe normally. Perform CPR. Nobody told me about CPR. CPR, right? What is CPR? Yeah, the cardiac respiration, right? The CPR. Then we have wait for help. Since you talked already the emergency, just wait for help. But first, this 5. Right now, let's continue. Now we have here trauma and injuries. You can say, for example, where is the bleeding coming from? Where is the bleeding coming from? De dónde viene el sangrado, right? You have to check that. Apply pressure, presión to the wound. Aplique presión en la herida. Presión en la herida in case of stopping bleeding, right? Keep the patient still. If you understand this, keep the patient still means consciente, right? Or maybe despierto. It depends on how you translate that. Mantén al paciente despierto, consciente, etc. Okay? Keep the patient still. Okay? Sorry, let's continue. Resuscitation, sorry, and cardiac arrest. Check breathing, circulation, ABC, right? Start chest compressions. Oh, start chest compressions. The CPR, right? Chest compressions. Call for the defibrillator, okay? Call for the defibrillator. That is another one, okay? In case you are working at an emergency place. Let's continue. So, vital signs. Always check blood pressure, heart rate, right? And the oxygen saturation. Sorry, that is oxygen saturation. Okay, that is also something that you need to check. The patient's pulse is weak or it's strong. That is another way to say, right? The patient's pulse. The patient's pulse is weak or strong. I don't know if you can see very well myself. It's okay. Respiratory rate is irregular. Irregular, right? That it is. Some other emergency phrases. Se escucha muy bonito. Thank you very much. Thank you very much. So, general emergency phrases. So, this is what you have to tell the patient when they have an accident, right? Stay calm. Stay calm. Quédese tranquilo, right? Help is on the way. Help is on the way. Ya está llegando o la ayuda está en camino, right? Do you feel any pain? Do you feel any pain? Where? Where? Where means donde. Where, okay? Can you hear me? Can you hear me? Or maybe we can say, can you listen to me? Two ways. Can you hear me? Can you listen to me? Okay. Then we have another one. It is open your eyes. Open your eyes. Right? Stay with me. Quédate conmigo. That's another one. Okay? Stay with me. Quédate conmigo. Right? We can continue now. Quick communication with emergency services. Okay, before doing this, I'm sure you know some of these other ones. So, can you write? Pueden escribir. Can you write now some other sentences related to vital signs or generating emergency phrases? Pueden escribir en el chat de Zoom, por favor. Algunas otras oraciones relacionadas con los signos vitales o frases de emergencia en general. ¿Ok? Pueden escribir, por favor. Start writing, please. In English or in Spanish, no problem. No hay ningún inconveniente en inglés o en español. Just do it, please. I'm gonna wait for your answers. Please. Very good. Por favor, ¿alguien puede aplicarle RCP? Please, can anybody do the RCP? The RCP or the CPR, sorry. Can anybody do the CPR? Can anybody do the CPR? Not apply. Apply es aplicar. Pero apply tiene otro significado, okay? Can anybody do the CPR to this person? The CPR with this person to this person, okay? Yeah. Please, deme permiso para aplicar primeros auxilios. Please, let me do the first aids. Let me do the first aids, los primeros auxilios, right? What else? Here I have another very nice from Katie. Yeah. What does it says? Se me subió. Denme un segundito, por favor. Ahora sí. Katie says, cesárea de emergencia por sufrimiento fetal. Yes. Por sufrimiento fetal. Very nice, very nice. Very good. So, you can say, for example, cesárea, just cesarean, okay? So you can say emergency cesarean due to fetal distress. Emergency cesarean due to fetal distress or because of fetal distress. Fetal distress. Olmedo. Tenemos otro acá. Olmedo está orientado en tiempo No me deja leer. Ok, ahora sí. Está orientado en tiempo, espacio y persona. Ok, very good. Está orientado. You can say, are you? Creo que eso es lo que se refiere. Are you time and space person oriented? Are you time? Are you in time, space, and person oriented? Okay, that it is. Yes, se escribe así, yes. Please, can anybody apply CBA? I'm gonna write it for you. Lo voy a escribir, don't worry. Can anybody apply a CPR? Can anybody apply a CPR? That it is. Okay, here I have another from Jennifer Neira. En la escala de Glasgow del paciente está en 13/15. Very good. Excellent. So, in a Glasgow scale, the patient is in 13/15. In a Glasgow scale, the patient is in 13/15. Okay, 13/15. Very good. That was excellent. Let's check if we have something in the YouTube. Bam, bam, bam. Okay, super. Thank you very much. That it is. Thank you. That is very good. That was very nice. It's very important to know all of these new ways to talk about the vital signs and general emergency phrases. If you like to add more, you can do it, okay? Si desean añadir más, pueden seguir escribiendo, que yo lo voy leyendo, okay? Let's continue. Quick communication with emergency services. Well, this is something that you can do as a patient or maybe as a doctor, right? This is an emergency. We need an ambulance. That is the most common. The most common. The patient is unconscious, not conscious, unconscious, and not breathing. El paciente es inconsciente y no está respirando. It's not necessary to say, and it is not, or he is not, because we are having just here is, I'm going to talk to you about the pure linguistic area. Okay, voy a hablar acerca de la lingüística pura. Dice, el paciente está inconsciente y no está respirando, pero no necesito decir is unconscious and is not, no. Este is va para los dos. The patient is unconscious and not breathing. Just that, and not breathing, okay? We are at, estamos en el lugar, right? Please come quickly. Quickly means rápidamente. You can use fast. Yes. Fast is also rápido y rápidamente. Fast hace las veces de adjetivo y de adverbio. Por tanto, puede decir, please come fast or please come quickly. No hay ningún problema, okay? So, here we have the next one, transmitting information. So, this is what you have to talk about the patient, right? It's a male or it's a female, es varón o mujer. It's a male or female. Approximately, like, around, otra palabra, around, 40 years old. Around 30 years old, 25, 13, I don't know. Severe chest pain, severe chest pain, difficulty breathing. Dolor severo en el pecho, dificultad para leer, right? Para respirar, right? That it is. Let's continue. Possible head trauma. Oh, possible head trauma. Now, this is something that we can say. Confirming instructions. Should we begin CPR now? Should we begin CPR now? Sorry. Do you recommend oxygen administration? Right? Hand over to paramedic. Patient with no allergies, vital signs are unstable. We started IV fluids and oxygen therapy. Remember IV intravenous, right? Intravenous. Very good. Here, sorry to cut you. I have a question here from Olmedo. It says, ¿cómo se dice canalice vía periférica? Okay. You can say, please do do the peripheral channel. Please apply the peripheral channel. Do the peripheral channel, not make. Do the peripheral channel or apply the peripheral channel. Canalice vía periférica. Okay? That means. Thank you very much. Now, IV, as I told you, is intravenous fluids and oxygen therapy. Before going with this, before working with this, please, it's time to continue working with you. Please start writing in the chat. Start writing in the chat. Some other sentences related to emergency services. Okay? The emergency room, for example, right? Please write down what happened with the patient. Not only the patient is unconscious and not breathing, maybe some other, okay, the patient is breathing too much internally, I don't know, inside the body, I don't know. You may write down. Pueden empezar a escribir, por favor, más ejemplos de los cuidados o lo que se debe hacer en emergencia, ¿ok? Por favor, empiecen a escribir. Write it, please. Lo que ustedes ya saben. Puede ser en inglés or in Spanish. There is no problem. We will be writing that for you. Okay? Voy a estar traduciendo para ustedes. I will be translating. Please, start writing, please. Empiecen a traducir. Empiecen a escribir, perdón. Okay? ¿Cómo se dice? Canalice vía periférica. Do the channel, the peripheral channel, okay? Or apply the peripheral channel, okay? So, continue, please, continue. Work. Escriban, por favor, escriban en el chat. Vamos, empecemos a escribir. ¿Qué más podemos añadir? Please. Ustedes tienen toda la experiencia para hacer esto. Empecemos. Thank you. Ya estamos empezando. Very good. Ana Naula. Tengo un nuevo mensaje de Ana Naula. Dice, perdón, se subió. Solicitar, tomar muestras. Se volvió a subir. De sangre para laboratorio. Ok. you have to say, please, I need to request or to take, please request to take blood samples for laboratory. Please request to take blood samples for laboratory or to laboratory. Okay, that it is for LB. Okay, that is, thank you very much. ¿Cómo se dice? Quirófano. Okay, that is the operating room or the surgery room. Quirófano is surgery room or operating room. Okay, surgery room or operating room. It will depend on you. Okay, continue, please. En un ejemplo, acá tenemos otro. A ver, veamos. En un ejemplo, el paciente está acostado y le decimos, manténgase inclinado y respire lentamente. Ok, manténgase, skip. Ok, inclinado es lean. Entonces puede decir, please keep leaning and breathe slowly. Ok, vamos a escribir. So you can say, please keep leaning and breathe slowly. Ahí está. That is, please keep leaning and breathe slowly. Manténgase inclinado y respire lentamente. Thank you very much, Mr. Cesar. Acá tengo otra, muy bien. Katy, de Katy. ¿Cómo se dice sala de parto? Ok. The birth room. Ok. Birth room. Ok. Sala de parto. Ok. Maybe there's another way, but that is. Also, you can say delivery room, labor room, también va a haber mucho eso. Ok. What else? Yeah, the birthing room, that it is. Ok. Delivery room, también delivery room. Ok. What else? Si pueden escribir algo más. Vamos a ver por el chat, déjenme ver, por favor, en YouTube. Very good. Aristides Rivas, thank you very much for being here. Okay, now. Aquí tengo uno. Acaban de enviarme otro. A ver, veamos. Ana Naula, ok. Ahora sí. ¿Cómo se dice? Activemos protocolo de clave roja en inglés. Ok. So, ¿cómo se dice activemos protocolo de clave roja en inglés? Ok. So, let's activate the red key protocol. Let's activate, activemos, let's activate the red key protocol. Red key protocol. Ok, vamos a colocar acá, vamos a escribir para que podamos entender todos. Let's activate the red key protocol. That it is. Let's activate the red key protocol. Okay, the red key protocol. Thank you very much. Thank you very much. Please, you can continue writing everything so we can add all the emergency services sentences, okay? So let's continue. Please, you can continue working with this. Confirming instructions, we did already. Now, let's talk about the hospital and clinical environment. Let's check the YouTube. Just give me a moment, please. Yeah, very good. So, very good. So we have these places in a hospital, right? And basic medical equipment. The ER is the emergency room, as I told you. The ICU, the unit care, intensive care unit. The OR, operating room, lo que me habían preguntado, operating room, or surgery room. Both of them are okay. Sorry. We have the laboratory, the pharmacy, pediatric ward or maternity ward, pediatric ward or maternity ward. Okay, that it is. We can also work with that. Okay. Before going to this one, the basic medical equipment, I know that these are parts of the hospital in which we have ER, ICU, OR, the rare department, the laboratory, the pharmacy, the pediatric ward, or maternity ward. But I'm sure you know some other areas at the hospital. Sé que ustedes tienen más conocimiento de otras áreas en el hospital. Por favor, empecemos a empecemos a escribir, por favor, las áreas del hospital, okay? In Spanish or in English, there is no problem. Please do it, please, do it. Do it. Mientras tanto, vamos a responder a uno más, a otra pregunta. Ahora sí, ¿cómo se dice nebulización? Es lo mismo. Generalmente las palabras específicas que vienen, como había indicado ayer, de un latín, es lo mismo en inglés. Por ejemplo, nebulización es nebulization. Lo mismo, solo que la C se cambia con T, ¿no? Nebulization. Ok, that it is. Sala de espera. Well, sala de espera is just the waiting room. The waiting room, okay? The waiting room. That it is, the waiting room. Oh, here I have another one. Very good. Thank you very much, Ana Paula. Neonatology, central de esterilización. Oh, that is very good. Oh, se me subió. There we have. So, central de esterilización. Very good. To tell the truth, esterilización es lo mismo. So you can say, for example, sterilization center. Pediatría, okay. That is only pediatrics, okay. Pediatrics. Gynecologist, okay. Unidad de cuidados intensivos, the ICU, right? The intensive care unit, emergency. Oh, that is very nice. Y lo tenemos en todo lado. Es la consulta externa. Yes, la consulta externa. You can say una forma muy, how can I tell you? Una forma muy literal, digamos, de decir consulta externa es external consulting, ¿ok? External consulting, que sería muy literal. Podemos decir outpatient department, que sería otra forma. Outpatient department, ¿ok? ¿Ok? Outpatient place, también se puede decir así. Laboratory, very good. Family medicine, very good. Family medicine, yeah. ENT, dermatology, dental, nuclear medicine. That is nice. That is nice. ENT, that is good. ENT, very good. That is otorino, right? Otorhinolaryngologist. Very good. Thank you very much. Thank you very much. ¿Tenemos otro más? No, we don't have another one. Okay, super. Thank you very much for your cooperation. Please start working. Continue working. Continúen, por favor. You can continue writing. Let me see if in the YouTube we have something. Yeah. Okay, so now we can go on. Basic medical equipment. Basic medical equipment. So in this case, we are talking about all the needs that you have in order to work in the medical area, right? So the first one, we have the stretcher, okay? We have the wheelchair, hospital bed. If you want to know what a stretcher means, it's camilla, right? The one that you use to take the patient and put it into the emergency car, right? Thermometer, wheelchair, silla de ruedas, right? Thermometer, blood pressure cuff, okay? Blood pressure cuff, right? That thing that we use to check the blood pressure, right? Stethoscope, the IV drip, the oxygen masks, the syringe injection, right? Syringe, but it's not an injection. Syringe is the object, right? If I can say that, object. Scalpel, syringe, jeringa, right? Scalpel, you know, the knife that you use to cut. Gloves, sorry. Gloves, bandages. The first aid kit. We have the plasters, right? The cotton wool as well. Cotton wool, right? That it is. So if you want to know exactly what plaster means, I want to tell you in Spanish, es el yeso, right? Yeso, plasters, okay? Bandages, gloves, syringe, masks, I think everything is done. The IV drip. Yeah, the IV drip is also el gotero intravenoso. That it is, okay? Yeah, I think everything, the rest you understand it because it's very similar to Spanish. Let's continue now. Let's continue. The surgical mask, which is completely different from the face mask, right? The stethoscope, oxygen need, eye chart, scales, resuscitator, pregnancy testing kit, right? Compression bandages, right? The resuscitator is that tool that you use to put oxygen in the person, but you have to apply it mechanical, right? That is the one. What else? Pills, you know pills. X-rays, yeah, X-rays as well, you know X-rays. IV, the hearing sample, right? The dropping cane, the dropper, gotero, right? The needle, aguja, needle, right? Antiseptic, very good, antiseptic. Examining table is another one, right? That you need to know. Do you remember that I talked to you about the eye chart? The eye chart es ese cuadro que tenemos con varias letras para poder ver si tenemos algún problema en la vista, right? We have a big E at the very beginning y vamos cambiando, ¿verdad? Ese es el eye chart, okay? Now, until here, hasta acá, I talked to you about all the basic medical equipment. Please, I would like you now, ahora me gustaría que ustedes empiecen a escribir aquello que ustedes utilizan y que no hemos hablado acá, ¿ok? Please, all the things that you use. En caso de ser de rayos X, pueden colocar inclusive el equipo, no, I don't know. Pero coloquemos, ¿qué es lo que más utilizan ustedes? ¿Ok? ¿Qué es lo que más utilizan? ¿Cómo lo hacen? Please, start writing down. Empecemos, por favor. Empecemos a escribir en el chat, ¿ok? Mientras ustedes escriben en el chat, debo indicarles que cualquier consulta pueden simplemente escribir o levantar la mano para que se les pueda activar el micrófono. Asimismo, que ya están en el chat de Zoom los teléfonos para que ustedes se comuniquen en caso de que no lo hayan hecho, para poder dejar sus datos y recibir los certificados correspondientes. Asimismo, si desean ya sea la presentación o el video del seminario, pueden también adquirirlo, simplemente tienen que dejar sus datos y preguntar, ¿ok? César dice tomografía. Ok, tomography. Ok, tomography. Vamos, continúen. Mientras tanto veo por el chat. Ok, perfecto. Vamos bien. Podemos continuar. Escribamos, por favor. Así tanto ustedes, todos juntos vamos a poder aumentar, engrandecer nuestro conocimiento en inglés, ¿ok? Yo les voy a ir diciendo a cada uno, traduciendo a cada uno, ¿ok? Ok, y empezamos. Very good, excepto. ¿Cómo se dice? A ver, no entendí muy bien esto. Lecho duro para pacientes politraumatizados. Ok, lecho duro para pacientes politraumatizados o politraumatizados. Creo que es politraumatizados, right? Lecho duro es lo mismo que decir cama, ¿ok? Cama es a hard bed, una cama dura, hard bed for polytrauma patients. Hard bed for polytrauma patients, ¿ok? Vamos a escribir hard bed for polytrauma patients. Ahí está. Microscope, very good. Microscope, collarín vertical, ok. Collarín cervical, perdón. Collarín cervical. That is just a cervical collar. Cervical collar. Cervical collar. Ah, lecho duro es una tablita. Ah, ok. Una tablita. Ok, enseguida vamos a traducir eso. Bomba de infusión. Coche de paro. Ah, very good. Bomba, tenemos uno de Ananaula, bomba de transmisión, de infusión, perdón, de infusión. That is just infusion pump, infusion pump. Oh, se me pasó. Infusion pump. ¿Qué más? Coche de paro. No sabría decirle coche de paro. The crash car. I don't know. The stop car. ¿Qué más indica? Laringoscopio. Laryngoscopy. Cuna de calor. Wow. Ok. Cuna de calor. It can be the heat cradle. The heat cradle. Cradle es cuna. So, cuna de calor puede ser heat cradle. Ahora, cuna de calor radiante. Yeah, the heat cradle. Yeah. Or radiant heat cradle. Máquina de anestesia. Okay. So anesthesia machine. In obstetric center, we usually use stethoscopes, thermometer, and surgical. Thank you very much, Katie. That it is. Super, thank you. A surgical mask, oxygen, surgical instruments. Very good. That is great. You see, we are learning more and more, and that is very good. So, thank you very much for all your participation. Continue, please, with the participation. It's very important. We need to work with this so we can enhance our knowledge about this basic equipment related to the medical area, okay? That is good. Thank you very much. Thank you very much for doing that. So let me see if in the YouTube we have something. No, we don't. Okay. So now let's continue. Let's continue, okay? Let's continue. Now, we have the healthcare professionals, okay? As I told you, these are just examples, okay? We will do with you again more and more. So we have the professionals related to the healthcare area, so doctors. In doctors, we have a lot of let's say, kind of doctors, right? The first one is the general practitioner, el médico general. The surgeon que hace la cirugía. So, cardiologist, el cardiólogo. Pediatrician, anesthesiologist, that it is another one, as examples, okay? Then we have nurses, is the registered nurse, the nurse assistants, and the head nurse, right? Las enfermeras, asistentes de enfermeras, y the head nurse, la persona que está encargada de las enfermeras, right? Other healthcare staff, pharmacist, yes, los farmacéuticos, right? Physiotherapist, los fisioterapistas. Radiologist, paramedic, lab technician, right? Lab technician as well. So these are some examples. What is supporting staff? Receptionist, janitor, orderly, all of them. But please, I would like you to start working with this. Maybe we have more here. No, this is the ones. Okay, please, what I need you to work with is to start writing what doctor you are, okay? So what specialization do you have? ¿Qué especialidad tienen? Or subspecialty, no sé, or subespecialidad, I don't know. Because we have the general doctor or the practitioner, general practitioner. We have the specialist doctor and the subspecialist doctor, right? Tenemos el médico general, el médico especialista y el subespecialista. So please, I want you to start writing the kind of doctors that you are, your specialization. ¿Cuál es su especialidad? Okay, please write down in the chat, in the Zoom chat. Empecemos a escribir y vamos a colocar en inglés, okay? Vamos, please. Tengo el primero de Olmedo. ¿Cómo se dice? Líder de servicio. Ok, lo tengo acá. Lo tengo acá, no como líder de servicio, pero sí lo tengo. Aquí está. Receptionist, janitor, orderly, ok. Líder de servicio puede ser the service leader, ok. Se puede llamar así, the service leader, ok. Líder de servicio, muy bien. Continuemos, por favor, con la subespecialidad o especialidad, la especialidad que ustedes tienen, por favor. Como doctores, como enfermeras, como personal de servicio. I know, yo sé that not only doctors are working there, also administrators, also human resources, also even lawyers. But please, I want you to write it. I am a nurse. Katie, thank you very much. I am a nurse. I work in obstetric center, but I am studying nursing in critical care. Oh, so congratulations. That is one. So Katie is a nurse. She works in an obstetric center, so she's an obstetric nurse, but she's studying also nursing in critical care. So that is very, very good. Thank you very much, Katie. Thank you very much. Sorry, Katie. Let's continue, please. Who can continue working? Writing, please. Write. Empiecen a escribir, por favor. Vamos a engrandecer nuestro vocabulario en inglés. Please. Pueden escribirlo en inglés o en español. Freddy, ¿por qué no lo hace? Hagámoslo, Mr. Freddy, por favor, escriba. Tenemos bastantes personas. Stefan, if you can write it, please. Si están estudiando también, student of, right? I work as a nurse in an obstetric center. Very good, Ana Paula. Thank you very much. Nursing is very, very important. Thank you, thank you. Olmedo, please write down what you're studying, what you're doing. Thank you. I am a registered nurse. I work in emergency room. Oh, thank you very much, Olmedo. Thank you very much and congratulations. That is very good. Continue, please continue. Write all your professions. I'm gonna turn on the light. Yeah, I think you can see me better now. Yes. Continue, please, continue. Thank you very much. Vamos, sigamos escribiendo, por favor. Escriban. O pueden escribir otras profesiones relacionadas con el área médica, no hay problema. Escriban todo lo que saben. A pediatrist, for example, neurologist is another one. I work as an accountant for a clinic. Oh, thank you very much, Stefan. Accountant for a clinic is very important as well, because without an accountant, the clinic or the hospital doesn't work, right? Neither of them. Thank you very much. I'm a biomedical pharmacist. Oh, biochemical pharmacist. Excellent, biochemical pharmacist. Thank you very much, Natalie. Let's continue. Work, please. Let's participate. We have neurologists, cardiologists, traumatologists, head nurse, pharmacist, biochemical pharmacist. We have also, what else I can tell you? The ones that I remember. Yeah, that it is. The internists, los internistas también, right? Neurologist, right? Neonatologists, another ones. So we have a lot of people that work in a hospital. Please continue writing down. Biomedical pharmacist, excellent. That it is. Super, very good. Let's continue now. Well, continue writing down your professions, okay? This is something that we need to tell our patients in English, right? It says rules and etiquette, okay? These are rules. First, wash your hands before and after patient contact. Wash your hands before and after patient contact. I don't have to tell you why, because you already know the reason, right? Wear gloves, guantes, right? Gloves, masks, I forgot to bring my mask. Masks, and protective equipment when required. When required, not all the time, right? When required. Protective equipment, you understand what it is. I have one more. I like my nursing profession. Yeah, I am sure, Miss Ananaula, it might be excellent. I know the nursing is amazing. Nursing is amazing, Miss. Thank you very much. Respect patient privacy and confidentiality. These are the rules and etiquette for people that work in the healthcare area, right? So, respect patient privacy and confidentiality. Great. Now, let's continue. Roles and teamwork. Doctors diagnose and prescribe. Okay? Diagnose and prescribe. Please. Here I have something else. Just give me a moment. Okay. Now, for example, nurses monitor and provide direct care. And this is very, very important. This is very important, okay? It says here, doctors diagnose and prescribe. Los doctores diagnostican y prescriben o recetan. Please don't say recipe. This is very important. Recipe is also receta. But recipe means receta de comida, receta relacionada con esto, ¿ok? Una receta para un queque, qué sé yo. Eso es recipe. Para los doctores, la receta médica es prescription. Prescription. Please do not forget that. Prescription. Do not say recipe. Recipe is another thing. Prescription. Okay? The doctors diagnose and prescribe. That's why it says prescribe. Okay? Nurses monitor and provide direct care. Direct care. Okay? Then technicians operate medical equipment. Who are the technicians? All the people who work with medical equipment, okay? Who are doctors as well, as far as I know, right? They are also doctors, okay? That is very important. Hierarchy in healthcare. Let's work with healthcare hierarchy. Chief of medicine, yes. The chief of medicine is el jefe médico, okay? Chief of medicine, el jefe médico, chief of medicine. Specialist, yes, manejan especialistas, right? Goes the first one, the chief of medicines. Then the specialist. Then come residents. Then comes the nurses. And then come the assistants. Okay? So all of them are working as a hierarchy in healthcare. Chief of medicine, specialist, residents, nurses, assistants. We can also say subspecialist, specialist, general doctors, residents, nurses, assistants, right? The clear communication and respect across all roles is very important. And I don't need to tell you that because you already know that, right? But that is. Now, I already told you about the specialists and subspecialists. So you can say, for example, if we have a specialist, a neurologist, we can have another one, a pediatric neurologist. Es una subespecialidad, pediatric neurologist, ¿verdad? Neurólogo pediatra, it's another one, right? It's a subspecialist. So this is what we need to know about it, okay? Before working with documental writing, so do you have any question about it? Because I need to start working with you with something else. Please, I want you to write now, what are the rules that you may know in hospitals? ¿Cuáles serían algunas reglas que ustedes tienen dentro del hospital? Related to the healthcare area, of course, relacionado con el área médica, ¿ok? Vamos, escriban uno o dos en el chat de Zoom, por favor. Vamos a esperar. Escriban algunas reglas que tienen dentro de los hospitales o fuera o de las clínicas. For example, the patient relatives, yes, the patient relatives can just visit them in certain hours, right? They cannot get into any time during the day in hospitals, for example, or public hospitals. They can just get into the hospital to visit their patient, their relatives, maybe 2 or 3 hours a day, maybe in the morning, or I don't know. Do not eat. Oh, very good. And all that is very good. Do not eat in the hospital. Yeah, one, because it's not good, and that's the second, because obviously it's not common to eat at a hospital, right? You may get any disease. Very good. So another one, please. Another one. Another rule that you have in the hospital. At the hospital, please. I'm gonna wait for you. Escriban otras reglas que tienen en el hospital, por favor. Puede ser en español, no hay problema. Yo voy a ir traduciéndolos. Do it, please do it. Vamos, escriban. Mientras tanto, indicarles que si quieren hacer uso del micrófono, pueden simplemente levantar la mano virtual y se les va a encender autorizar el micrófono para que puedan hablar, ¿ok? Wear personal protective clothes. Yes, wear personal protective clothes. Very good. Yeah, what are the personal protective clothes? We have the face mask. Do not use the uniform out of the hospital. Oh, very good. Do not use the uniforms out of the hospital. Yes, out of the hospital. Yeah, that is a very important rule, right? So talking about wearing personal protective clothes, we can use the face mask, maybe the glasses, the protective glasses, I don't know. You can also have the surgery hat, right? El gorrito de cirugía, right? Another one, for example. You can use the hospital uniform. Very good. So continue writing down, please. Writing down. It's very important to know that. I'm waiting for you, just one or two more, and that will be all. Let me see if we have something in YouTube. Uh-huh. Yeah, no, not yet. Okay. So while you are writing, let's continue. Okay. Let's continue. We have medical documentation and writing. Okay. Medical documentation and writing. So, how to write brief clinical reports in English. This is very important as well. Yes. We are going to start working with the SOAP notes. Is the common structure. Okay. Is the common structure. Let's see. Do not use uniform in the hospital. Perform proper hand washing. Yeah, that is extremely important, Ananola. Perform proper hand washing. This is very important. Thank you very much. Thank you very much. When we continue writing, I'm gonna still waiting for your answers. Please continue writing about the rules that you have, okay, in the hospital. So let's continue. Let's go on. So we have this kind of writing. I am sure that maybe you have a specific way of writing in at a hospital or in the hospital you are working in, but this is just a general idea of how to write it in English. Okay. So we work with the SOAP notes. What is the SOAP notes? This is an acronym. S is as a subjective, O is the objective, A is the assessment, the diagnosis, and the P is the next step that you are going to work with, okay? The treatment. So, as the subjective, for example, patient complains. You have to report all what the patient tells you, right? Patient reports chest pain for 2 hours, bleeding for at least 5 minutes, or constant bleeding, feels very weak, a lot of pain in the chest, headache, that it is. All the subjective means patient complaints, okay? Now let's go to the objective. When we talk about the objective, you have patient. So, vital signs, blood pressure, I don't know. Test results. For example, blood pressure 140/90. Oof. It went up, right? The pulse is 110. Okay, that it is. So something is happening there, right? That is the objective. So all the vital signs that you tested in the patient. The assessment, the diagnosis, the clinical impression, what you are thinking, what the patient may have, what is the problem with the patient, okay? For example, probable myocardial infarction, right? So that is the diagnosis that you can write thinking about the complaints and all the vital signs that you checked. Obviously, you will have a result. Okay, according to this, we have this, the assessment, right? The patient has this. Now, the treatment is P. What are the next steps that you are going to do? I mean, the treatment. So, admit to ICU, start oxygen therapy in that moment. Start OT, oxygen therapy, right? So to put on the oxygen mask and start making him breathing artificially, right? Admit to use. I don't know, maybe you can say just take these pills one every 8 hours for 7 days. This one in case of pain, I don't know. That is a treatment that you are deciding to do, right? Now, discharge summary basis. So the basics are reasons for admission, treatment given, condition of discharge, follow-up instructions, right? So this is the way you need to work when you have to write brief clinical reports in English, okay? But let's continue. Now, here we have something else. Informed consent. This is the consentment that you need to make to do with the patient, right? I understand the risks and benefits of this procedure. Comprendo los riesgos y beneficios de este procedimiento, right? So this is what you have to tell the patient, and he has to sign. Here I have another one. Thank you very much, Mr. Julio Matias Suarez. Thank you very much. Thank you very much. So, I give my consent for surgery. Yo doy mi consentimiento para la cirugía. All the time when you need to have to do a surgery, the patient must read and sign a consentment that you have to give them in order to make them feel that this is the procedure, right? So, talking about prescriptions, take one tablet twice daily after meals. Take one tablet twice daily after meals. Apply this to the affected area once a day. Once a day, right? It's a common prescription abbreviation. The common prescription abbreviation is BIT, TIP, PRN, STAT. Twice a day, 3 times a day, when it's needed, right? That it is. Talking about prescription, I'm going to tell you what to do later on. We have also the post-operative instructions. When we talk about post-operative instructions, we're talking about this. Do not lift heavy objects for 2 weeks. Oh, right? So keep the wound clean and dry. Keep the wound clean and dry. Also, we have return for follow-up in 7 days. Follow-up means seguimiento, control, right? In 7 days. Return for follow-up in 7 days. Well, these are some examples about what you have to write in the informed consent, the prescriptions, and the post-operative instructions. Now, I need your help, because in this moment we're going to start working with the chat, the Zoom chat, the Zoom chat. I want you to write some other ways that you communicate to the patient when you need to practice a surgery with him, on him. Okay? Not only understand the risk, I give my consent. So what else do you usually tell the patient, or usually make them write, sign in the paper, so who is giving the consentment, okay? The consent. So please, can you write it? Also, the prescriptions. You can write the prescriptions, some prescriptions that you used to do. And what are the instructions of post-operative, after a surgery? Let me tell you that way, okay? Please write down, por favor, si pueden escribir en el chat de Meet, qué es lo que ustedes usualmente colocan antes de hacer firmar el consentimiento, qué más colocan, o qué recetas le dan, cómo hacen la prescripción, ok. con el paciente, qué le dan, cómo le dan la receta, cómo, el modo de uso y las instrucciones postoperatorias, que es lo que ustedes generalmente colocan. ¿Qué le dicen? Coloquemos un poquito en el chat de Zoom, por favor. Coloquemos un poquito en el chat de Zoom para que podamos distribuirlo con todos. Si es en inglés, está perfecto. Si es en español, también yo lo voy a traducir al inglés. ¿Ok? Espero, por favor, sus resultados. Esperen, empiecen a escribir, por favor, en el chat todo lo que ustedes necesiten. ¿Ok? Vamos, vamos. Escribamos, por favor. Escribamos, escribamos. Voy a esperar un momentito, mientras tanto indicarles que no se olviden que si desean participar solo tienen que levantar la mano virtual y se les va a habilitar el micrófono. Y si todavía no han dejado sus datos personales para la entrega de los certificados correspondientes o el video del seminario o la presentación, solo comuníquense con los teléfonos que aparecen en el chat de Zoom y dejen sus datos, ¿ok? We also we used to inform consent for blood transfusion. Very good. Totally right. Totally right. So when you have to do a medical, a blood transfusion, you need to ask for the consentment, right? Signed by the person. Yeah, totally right. So you have to ask for that too. Very good. Take the medication every 8 hours. Very good. Yeah. Another prescription, the IT, right? Every 6 hours. I don't know, right? Continue, please. Continue. You can write in the Zoom chat. Nada por vía oral, reposo absoluto. Perfecto. Solución salina, 30 gotas por minuto. Ketorolaco, 30 miligramos cada 8 horas. Sonda vesical. Very good. So nothing by mouth, nada por vía oral, nothing by mouth, nothing by mouth. Okay. Absolutely resting, total resting, reposo absoluto, total resting. Okay. Total resting, reposo absoluto. Don't forget, nada por vía oral. Nothing by mouth, okay? When we talk about the next one, la solución salina, is the same. I mean, saline solution, 30 drops or 30 teardrops per minute. Teardrops per minute, okay? Ketorolaco, 30 milligrams every 8 hours. Every 8 hours, ¿ok? Sonda vesical, creo que ya lo habíamos indicado. That is the urinary catheter, or vesical catheter, or urinary catheter, ¿ok? Thank you very much, sir. Take your medicine once every 8 hours after each meal. That is good. After each meal. So after breakfast, after lunch, after dinner, right? Excellent. Thank you very much. That is the way. Super. Thank you. Thank you very much. Well, if you can write something else, I'm gonna wait 30 more seconds. So you can write, please. Sorry, drinking some water. It's okay to say, place pneumatic compression stocking after surgery. Yes. Colocar medias de compresión neumática después de la cirugía. Yes. Place pneumatic compression stockings after surgery. That is very good. That is the way you need to tell the person, the patient, okay? Because we cannot say socks. stockings means something that is gonna be applied on the place. That's why it's stockings, okay? Place pneumatic compression stocking after surgery is very good. Colocar medias de compresión neumática después de la cirugía. Perfect, perfect, perfect. Okay, let's see. I forgot the YouTube. Let's check it. Let's check it, please. Okay, everything is working well. Laboratory worker, pharmaceutical. Thank you. Hi, I am a chemistry pharmaceutical specialist in chemistry laboratories. Excellent. Thank you. Thank you very much. That is the way. I am a chemistry pharmacist specialist in chemistry laboratory. Patito Jimenez, thank you very much. Pharmaceutical and laboratory worker. Thank you very much. So that is the way we are working, not only with the Zoom chat, but also with the YouTube chat, the live, right? So let's continue. Let's continue. We are about to finish, and we have to talk about, this is very important, about how to talk with the patient in English, okay? I elaborated this way in order to make you work easier with the English language. So, we know that we have some tenses in English, obviously in Spanish as well, but in English. The first one that we are going to talk about is the simple present or present simple. Then we have to talk about the past simple, and we have to talk about the present perfect. These three tenses are the most commonly used to talk about medical care in English, okay? When do we use the simple present or present simple? We use it for facts and general statements. What do I mean? Para hechos y general statements. Things that you can write in a general way, okay? To establish their general statements. The patient has diabetes. El paciente tiene diabetes. The patient has pneumonia. Ah, el paciente tiene neumonía. Ok. Utilizamos el presente simple para hablar de estos hechos, cosas reales. Ok. I use the simple past for medical history. Para hacer la historia médica utilizo el pasado simple. The patient was admitted yesterday. El paciente fue admitido el día de ayer. The patient was admitted this morning. El paciente fue admitido esta mañana. Llegó con un cuadro severo de alergia o un cuadro severo de, I don't know, de hemorragia. Okay. Llegó. Se produjo, se realizó, se hizo los laboratorios necesarios, qué sé yo. Entonces, todo lo que tienen que escribir en la historia médica debe estar en simple pasado. Se hizo, se trabajó, llegó, comunicó, ok. When we talk about the present perfect, cuando utilizo el presente perfecto for ongoing or recent conditions, utilizo el presente perfecto tanto en historia médica. Cuando el paciente presenta ciertos síntomas que hasta el momento no se han podido eliminar. Example, the patient has had fever for 3 days. El paciente ha tenido fiebre por 3 días. ¿Qué estoy indicando? Sorry if I talk to you in Spanish. Disculpen si les hablo en español. Es muy importante establecer esto. El paciente ha tenido fiebre por 3 días. Significa que hace 3 días que empezó la fiebre, pero hasta ahora no pasa. Oh, that is something internal. Es algo interno. Muy bien, debe haber alguna hemorragia o algo que está sucediendo internamente, por eso no tiene esta fiebre y no se le pasa. Ok. Tiene fiebre por 3 días. Ha tenido fiebre. Has had. El presente perfecto es el has tenido. He hecho. Ha comido. Es el hado, edo, ido de los verbos. Ha tenido fiebre. Right? The patient has had a stomachache since yesterday. El paciente ha tenido dolor de estómago desde el día de ayer. Ok. That is nice. That is good. ¿Qué es lo que estoy haciendo? Estoy estableciendo parámetros para la buena comprensión de la historia médica, ¿verdad? That it is. ¿Qué más puedo decir en presente simple? No solamente el paciente tiene diabetes, sino el tratamiento. Se empieza con el tratamiento de, qué sé yo, como han escrito en el chat, ketorolaco, 30 miligramos, qué sé yo. Entonces, se inicia tratamiento. ¿De cuándo se inicia? Ya, ok. Se puede escribir con pasados simple. Se inició tratamiento con ketorolaco, pero el paciente continúa con sus dolencias. Se cambiará a algo más fuerte, qué sé yo. Ustedes ya saben cómo trabajar con esto. Entonces, lo más importante en inglés, presente simple para hechos, factos, en general. Pasado simple para hacer una historia médica. Y también el presente perfecto cuando se presentan los síntomas y hasta ahora no han pasado, no se han perdido. También yo puedo indicarles que utilicen el presente perfecto para acciones que han tomado y cómo ha estado yendo evolucionando. The patient has improved a lot. El paciente ha mejorado bastante, pero no significa que está bien. Sigue mejorando, sigue en el hospital. Ha evolucionado afirmativamente, ha evolucionado correctamente, ha evolucionado de manera, I don't know, right? Entonces, utilicen siempre el presente perfecto para hablar de acciones que se iniciaron en el pasado, pero que hasta el momento se siguen haciendo en el presente, se sigue realizando. Ese es el presente perfecto, ¿ok? Please think about it. It's very important. Okay? Here I have used to talk about a punctual action in the past and the present perfect for ongoing or recent conditions. Used to talk about an action started in the past and it continues into the present and even in the future. So that it is. Okay? Passive voice. Utilizo la voz pasiva para hacer reportes médicos. I use the passive voice to talk about medical reports. Okay? The procedure was performed under general anesthesia. El procedimiento fue realizado bajo anestesia general. Fue realizado. ¿Qué es la voz pasiva? Que no involucra al sujeto, sino que la acción recae sobre el sujeto, si me pueden entender. Por ejemplo, el procedimiento fue realizado bajo anestesia general. Es mejor que decir el paciente, al paciente es aplicado con anestesia general para hacer el procedimiento. No. ¿Qué es lo más importante? ¿Por qué utilizo passive voice? Why do I use passive voice? Porque la acción que se realiza es lo más importante. La acción que se va a realizar es la más importante. Por tanto, por ser esta la más importante, debo utilizar la voz pasiva, porque la voz pasiva me indica que realza la acción sobre el sujeto. ¿Ok? That is the way. In that way, we use passive voice to talk about medical reports. Blood samples were collected and analyzed. Ahí está. No, muestras de sangre fueron recolectadas y analizadas. ¿Cuál es la acción? La recolección de muestra de sangre. ¿Cuál es la acción en la primera? El procedimiento realizado bajo anestesia total, right? Then, modal verbs in recommendations. Para las recomendaciones siempre utilizamos los verbos modales, ¿ok? The patient should take the medication with food. Should take the medication with food. Should, must, the patient must avoid alcohol. En este caso, hay verbos modales que me indican la prohibición o la prohibición parcial o la posibilidad. Si utilizo must, estoy indicando que es una obligación que se realiza sí o sí o que no se realiza para nada. The patient must avoid alcohol. The patient must stay in bed absolutely. That it is. El paciente debe estar absolutamente en cama, completamente, en reposo, right? The patient must. Cuando utilizo el should es una acción que no es tanta la prohibición. Should take the medication with food. Debería tomar la medicación con comida. Ah, perfecto. Debería. Puede que en algún momento se olvide, ok. Pero no pasa nada. Pero must es algo muy importante, ok. ¿Por qué utilizo must? Obligaciones. ¿Por qué utilizo should? Una obligación, pero no es tan fuerte, si lo podría decir así, ok. That is very important. ¿Ok? Ahí están should, must, would, can and could. Would, can and could. Estos tres son no para obligación, sino para posibilidad. The patient would have short walks. El paciente podría caminar, hacer pequeñas caminatas. Would or could or can. ¿No? Can es lo mismo que could. Posibilidades, ¿ok? The patient could take cold water. Ah, puede tomar agua fría. Puede o no puede, no hay problema. ¿Ok? So, to be clear, should and must for obligation, would, can or could para posibilidades que son más relajadas. ¿Ok? That is very important. So, until here is the seminar related to the healthcare medic. ¿Ok? Hasta acá estamos terminando con la parte del inglés relacionada con el área de la medicina. Espero que haya sido muy útil toda esta información que hemos brindado y que puedan aplicarlo ustedes utilizando inglés, porque todo lo que se les dio ya lo tienen, ustedes ya lo saben, pero ahora lo están haciendo en inglés, ¿ok? Eso es lo más importante. Entonces, bueno, hasta acá el seminario. Muchísimas gracias por su atención y bueno, pues espero que haya sido de mucha utilidad este seminario. Nos vemos en una otra oportunidad. Que les vaya muy bien. Hasta luego.